10 signs of high blood sugar you really shouldn't ignore. You might think it would be obvious if you had high blood sugar. But it's actually entirely possible for signs of high blood sugar to fly under the radar. There are a lot of people who don't realize they have high blood sugar. So if this is the case for you, you certainly aren't alone. As of 2018, more than 34 million people in the US are living with diabetes. The condition that occurs when your blood sugar is too high. Either as a result of insulin resistance, in the case of type 2 diabetes, or as a result of your pancreas not making any or enough insulin, in the case of type 1 diabetes. According to the Centers for Disease Control and Prevention, CDC. But 21% of adults with diabetes are unaware they have the disease, according to the CDC. In addition to that, there are about 88 million US people, or more than 1 in 3 adults, who have prediabetes. Which occurs when blood sugar is higher than normal but not high enough to be called diabetes. And only 15% of adults with the condition reported that a health professional had diagnosed them with the illness. Signs of high blood sugar. 1. Fatigue. Feeling tired may be the most common early sign of high blood sugar, Dr. Hatipoğlu says. It's also one that can occur, to a mild degree, with even the mild and normal blood sugar fluctuations that happen in people without diabetes, or with prediabetes. When they consume a large amount of simple carbs, like sugar, she says. 2. Frequent urination. When you have too much sugar in your blood, your kidneys start trying to pour out more sugar to get rid of it. And as they excrete the sugar, they pull out water with it, Dr. Hatipoğlu explains. This makes you have to visit the bathroom more than usual. 3. Increased thirst. This is a natural effect of peeing more, Dr. Adimulam explains, because your body becomes dehydrated. People start feeling thirsty all the time, Dr. Hatipoğlu says. The dehydration also becomes cyclical, the Mayo Clinic explains. The more you pee, the thirstier you are, the more you drink, the more you pee, and so on. 4. Headaches. Dehydration from any cause can trigger headaches, Dr. Hatipoğlu says. Of course, headaches can be a sign of many different things. But it's worth getting checked out if it's something new or coupled with other symptoms here. The dehydration can also worsen your fatigue in addition to your headaches, by the way. 5. Blurred vision. When there is excess sugar in the blood, it can affect some unexpected areas in the body, like your eyes, according to the Cleveland Clinic. Essentially, extra sugar, along with a little water, gets trapped in the lens in the middle of the eye, causing a blurred effect, Dr. Hatipoğlu explains. This is temporary and not the same as the damage to the eye that can occur in the long term with a condition like diabetes. 6. Nausea, vomiting, confusion, and more. These seemingly disparate symptoms are all signs of a rare and life-threatening state called diabetic ketoacidosis (DKA). According to the U.S. National Library of Medicine, DKA can cause the symptoms above, as well as stomach pain, trouble breathing, dry or flushed skin, fruity-smelling breath, or difficulty paying attention. It usually occurs in people with type 1 diabetes and is sometimes the first sign they are sick, according to the U.S. National Library of Medicine. More rarely, DKA can occur to a milder degree in type 2 diabetes. 7. Recurrent infections. Consistent hyperglycemia can weaken the body's immune response, according to the CDC. This makes it harder for your body to fight off some infections, making them more frequent, lingering, or serious. 8. Slow healing sores. High blood sugar levels can affect your body's circulatory system as well. Dr. Hatipoğlu says, impairing blood flow and the body's ability to heal itself. Sores that take a while to heal, often on the feet, are a common sign of this decreased circulation, according to the Mayo Clinic. 9. Dental issues. Glucose is present in your saliva as well as your blood. When there's too much of it, it helps harmful bacteria in your mouth grow and combine with food particles to create plaque, the NIDDK explains. This leads to issues like tooth decay, cavities, gingivitis, gum disease, and bad breath. Swollen, tender, and bleeding gums are one of the first things to look out for. 10. Tingling hands and feet. Over the years, hyperglycemia can begin to impact nerve function and eventually cause nerve damage, called neuropathy, Dr. Hatipoğlu says. The most common kind of neuropathy is peripheral, according to the NIDDK, which affects the extremities. You might start noticing feelings of tingling, numbness, or burning in your hands, feet, arms, and legs, per the Mayo Clinic. When to see a doctor? If you're experiencing one or many of these symptoms enough for it to raise a mental red flag or affect your life, like because you're too tired to make it through the day, that's a sign that you should talk to a doctor about your concerns. An expert like a primary care provider can help determine if high blood sugar due to diabetes or prediabetes is the cause of your symptoms. Even if you're not sure that's exactly what's going on, it's still worth having a conversation with your doctor about hyperglycemia and other possible causes behind your symptoms. Do you have high blood sugar or diabetes? What are some ways you can tell that your blood sugar is too high? And what are some things you do to ensure that your health is in good condition? Let us know in the comment section below. Thanks for watching.